I'm Scott Sarran. I'm the Chief Medical Officer for MoreCare. My background clinically is as a geriatrician with a significant amount of past experience in senior living settings, whether nursing facilities, assisted living, or other freestanding settings. And my role with MoreCare includes ensuring that we're working closely together with the Pathway SLFs to keep our members healthy and respond to their illnesses in as quick and coordinated a fashion as possible. Part of that function, particularly this very challenging year, includes supporting Pathway SLFs in everything they do to help keep their employee workforce as healthy as possible. Flu vaccination is important for everyone every year. And as most people, I think, know, flu vaccines are recommended for everyone over the age of 6 months. Flu vaccines every year prevent thousands of unnecessary deaths. This year, in particular, and particularly for healthcare workers can catch flu or other illnesses in the community at home and bring those germs into the facility. And we know that all of you, all people who work in healthcare workers, the last thing you want to do is ever expose the patients you're caring for unnecessarily to a germ, right? Because we all know that the patients you care for are so frail and at such high risk for complications should they catch an infection, that we want to all do the best job we can of keeping them safe. We also know, of course, that the patients you care for, the residents of Pathway facilities, although they may all get the flu vaccine each year, because of their age and frailty and underlying medical conditions, they may not get the same degree of protection from the vaccine as you or I would, meaning that as people age and become more frail and have a variety of underlying medical conditions, their immune system may not process a vaccine with the same effectiveness, and so they may lack full protection, right? So very important for healthcare workers always to be up to date on all their vaccines, particularly seasonal influenza vaccines. This year, everything, of course, around influenza control and influenza vaccines has a heightened importance because of COVID. And you might ask, what's the connection between flu vaccinations and the COVID pandemic that we're unfortunately experiencing, and very unfortunately experiencing a true surge of at the current point of time. Right now, COVID is at such a high degree of prevalence in all communities, all states, essentially, that the healthcare system in many parts of the U.S., and certainly in many of the communities where Pathways has facilities, the healthcare systems are at risk of being overwhelmed. And in that environment, the last thing any of us want to do is to have an unnecessary illness. And that's what influenza is for most of us. It's an unnecessary illness because it's essentially preventable with a simple vaccine. So the last thing any of us want to do is to create a new burden for the healthcare system at this point in time. Much less, again, the last thing any of us want to do at this point in time is unnecessarily expose our patients or our families to influenza when it's so simply preventable. And let's also remember, absolute worst case scenario that we would never want for anyone is to have a case of influenza, again, essentially entirely preventable with a simple vaccine. Worst case scenario is to be sick with influenza and then be exposed on top of that to COVID, which we know is circulating. Influenza immunization is good for everyone every year, the right thing to do, especially every year important for healthcare workers. But oh my gosh, this year in particular with COVID, it's just got heightened importance for all of us. When people say they get the flu vaccine and they get sick, what they're describing isn't that they're getting flu from the vaccine, because the vaccines in use are what's called inactivated vaccines. There's no live germ in the vaccines. Therefore, it's impossible to catch influenza from the vaccine. What people experience when they say, hey, I got the vaccine and then I got the flu afterwards, is they're describing flu-like symptoms that in reality are the manifestation of your body's healthy immune system processing the vaccine and making antibodies to protect against influenza. So it's the side effects, which most commonly are either achiness in the site where you get the flu vaccine, usually the arm, or perhaps some low-grade fever or generalized muscle aches, typically lasting no more than a couple of days. Those symptoms are the body's immune system taking up the chemicals from the vaccine and making antibodies that create the immunity to flu. So they're really, to some extent, they're expected reactions to your body doing what it's trying to do and is successfully doing. Serious reactions are incredibly, incredibly rare with all the flu vaccines available these days. Each year, because the flu viruses that circulate change from year to year, each year the vaccines are newly made with the best thinking incorporated around which strains of influenza are most likely to be circulating in a given year. So it's a little bit of looking at what types of influenza, and there are several types, are circulating in the environment, and then basing the vaccine off the best thinking on what those types are going to be this particular flu season. We have very good reason to believe that the vaccines available this year are, in fact, a good match for the viruses that are circulating. So extra reason to have good confidence that, again, not only is the flu vaccine quite safe, as we just discussed, but it's particularly going to be effective this year. The flu vaccines that are made today are part of it's a 40 or 50 year history of each year getting a little better and a little smarter about how to produce safe and effective vaccines. And the amount of research, the amount of safety engineering in the production and distribution of the vaccines it's just phenomenal. And the amount of data that's tracked each year on how many worldwide, literally billions of people get flu vaccinations, and how relatively incredibly rare serious side effects. It's just huge. It's so we recognize that for a variety of reasons, people are concerned about safety of and effectiveness of vaccines. But again, gosh, the flu vaccines in particular are so well studied, so well engineered. Again, each year, literally billions of people get the vaccines. There's so much monitoring and follow-up of people to see if there were any serious side effects. That it turns out, as a result, flu vaccination is at the top of every scientist's list of what the most safe and effective public health types of interventions that we have. That and some of the more common childhood vaccines, they're just top of the list of the most important things we can be doing to keep ourselves safe, keep our families safe, keep our patients and residents safe. Basically, anytime now through at least the end of the winter, Flu season in the United States typically starts slowly in September and then gradually increases with a peak each year, usually sometime between January and end of February. But that can vary from state to state, location to location. Bottom line, though, we're sitting here now in the very first part of December. There's no time better than right this minute to get a flu vaccine. Anyone who gets a flu vaccine now in December will almost certainly have protection from the vaccine that will extend all the way through flu season, which again, typically peaks in January or February in the Northern Hemisphere and then starts tailing off quite a bit into March. And the immunity from the vaccine lasts in most people at least 3 months. So again, bottom line, now, if you haven't already gotten a vaccine, there's just no time better than the present. Another wonderful thing about the flu vaccine is, as I think most people know, it's just so widely available. CVS, Walgreens, doctor's offices, you name it. I got mine at a Walgreens. It's very easily accessible.